came about tonight because we wanted to put together something where the hygienist wanted to get their hands on the scanner. Most of my practices, I have 7, 2 had scanners, and they were not able to really use the capability of the scanner. They didn't know about the scanner. They'd heard about it. Doctors were using it, some more than others. And so many months of planning, Eric was able to put together with myself and my managers an event tonight. And it was an hour and a half. We want to be respectful of everyone's time.
Things you treatment plan for are what? Crowns, fillings, what else?
Bridges.
What? Bridges? What else?
I was thinking
Invisalign.
Invisalign. I was thinking periodontal treatment, but that was
Okay.
number one.
Periodontal
I know that's what I was thinking too.
You literally can treatment plan 90% of the things that you do utilizing the scanner, utilizing the patient-facing applications and visuals, and that's what we're going to focus on today. So step 1 is introducing the patient to the scanner. Step 2 is scanning the patient, right? We're going to work on technique. We're going to work on speed. The more you practice, the more you scan, the better you're going to get. It's kind of like riding a bike. How long did it take you to learn how to ride a bike? I got 2 5-year-olds at home that I'm still trying to get up on that bike, right? But the more you practice, the better you get, okay? From there, we're going to utilize a patient-facing application called the occlusogram. The occlusogram is an amazing tool that will highlight and show tooth wear, right? So that you can actually use that and show your patient specific areas of concern of where their teeth are wearing down and it's being affected by their bite. She wasn't really interested in fixing the functionality of her bite or whatever for the sake of time. She just wanted to get the teeth clean and that's it. Okay, but I want to be able to show her, and not just show her, I want to know, because it's important to me as a hygienist, I want to know if there's been any changes in the last 12 months. Okay, so what I'm going to do is after I do the scan and I send it, okay, you come back here, you can select both of those scans, and then we're going to compare the selected. This is the best.
They were talking to me about my occlusion. They were talking to me about possibility of Invisalign. They were talking to me about all these things that they would usually talk to patients about, and it just flowed so
Roll
easy.
back in, roll it to the
Isn't that
label.
amazing?
And now, as you can see, I almost got it all, but I'm going to come right back, try and capture those 2 little blotches. But the computer will put it all together. So then, I'm going to stop because I'm going to take it to the buckle.
So when you say
Carrie's
stop,
gonna
you're
relax a
taking
little.
your fingers off.
I'm right here, that little button. And she's,
As a hygienist, we're very excited to not only have the hands-on experience, but also to be able to educate the patient and email it to the patient. So if it was for Invisalign and everything, they're able to take that video home, see the befores and after, talk to their spouses about it, and that'll just help close cases for us. So the excitement was across the board phenomenal.
Did you hear the chatter tonight?
I did.
Yes.
It was amazing.
This is something that can help you have a better conversation with your patient.
Yes.
And if so, give me like 1 or 2 specifics that you think would be better.
Well, for sure, the wear
Okay.
is something huge that we hit and miss a lot of times with patients, but to be able to actually show them with the color chart is pretty awesome. So I think visually, like you said, a picture's worth 1,000 words. So I think that's pretty awesome.
Visual patient education and
Yeah.
summary for me,
Yeah.
like that speaks more than anything that we could say.
Yep.
Absolutely. The recession and the occlusion, the whole
So we're
nine
talking
yards,
about favorite patient-facing applications and the ones that are really memorable to a patient. And one of the patient-facing applications that I hear hygienists love the most is the occlusogram. And Pooja, I know we were talking about this earlier. Where do you see hygienists using the occlusogram in your practice, and kind of how does that impact or change the dynamics of a conversation now compared to what it was before you had a scanner?
I think it helps with the conversation as far as where the patient's bite is, and where they can actually pull it up on the screen and make the 3D motion move around, where they can actually show where they're biting down and all the different. It maps it out for them. So we couldn't do that before, whereas with X-rays we can't do that with our pictures. iTero changes the game.
Absolutely.
And
Go ahead.
it changes the game because it has that color. To me, it looks like a radar, a Doppler for the weather, and so it really shows the highest points of where it's putting the pressure on the teeth so that it's a visual for the patient as well. So it helps validate what the hygiene and the doctors are saying.
And patients can actually take a picture.
They can take a picture of
They
it
can
with
take
their
a
phone.
picture. They can send it to their family members at home and say, "Look at this."
Yeah,
And I mean, there's the buy-in.
absolutely. And you don't even need to put your finger in the mouth. Use this as the guide. You see how the wand tip is curved like that? Use that to your advantage. So you don't have to move the lip. Use the scanner tip to move the lip. Perfect. And make sure that the head of the scanner, the tip, like if this is the tooth, you don't want it to be at an angle. You want it to be
So direct contact.
Just direct
Okay.
contact with it. Yep.
Okay.
What do you think they're going to take away from this training?
And I'll start out with that, Eric. For me, from a regional manager level, it's increased case acceptance. So that is a focus in our practices, and it requires practice. So tonight was about letting them actually get hands-on with the scanners, the managers.
Actually, it's a very, very good tool to educate the patient and show them, how important the functionality of their teeth and how.
It's going to be a great addition to be able to show people how we can change and improve their smile and their function of their teeth.
We're doing our own tutorial in here.
And they showed me how to use it, and I was like, hello, that was easy.